Hi, my name is Hannah Cruz. I'm doing your guys' scholarship and my STEM topic is nursing. So nursing is a field that incorporates mathematic and scientific processes to provide both cultural and ethically appropriate care to patients. Our main goals include health promotion, illness prevention, health restoration, and facilitating coping. So to meet these goals and maintain best practice, nurses take on a variety of roles in different healthcare facilities. So I'm going to go over these and elaborate a little bit more on how they can impact the client. Caregiver, it's probably the first thing you think of when you hear the word nurse. Nurses get doctor's orders, we give medication, we do lots of assessments, we assist the client with activities of daily living, and we also formulate a care plan and carry that out for their diagnosis. Communicator and collaborator. So our job as nurses in this regard is speaking with other physicians. We want to inform physicians on how the patient is doing and recommend things that may improve their quality of life. We also can critically solve issues with other nurses on how to best approach a situation. We also report information to the CDC regarding diseases and STDs, STIs, and we give referrals as well. In terms of communication, it is very important to communicate with patients on what they are wanting in terms of cultural and spiritual needs, because everybody is different. Everybody has different cultural and spiritual values and beliefs, and we want to incorporate those into their care so that we can give them the best care that they are looking for. We also provide therapeutic communication. This is one of the first things they teach you as a nurse. It is an empathetic approach. So let's say you go into your patient's room and they're crying. The first thing I would say probably is, I can see that you're visibly upset. Tell me more about what's going on. That's an example of therapeutic communication. Educator. This is especially important for patients and family. So let's say the doctor comes in, they tell them all this confusing stuff that they don't really understand, and the nurses are there to put it simply and in layman's terms so that the patient can better understand what's going on. We also give information regarding management of diseases or disabilities and answer questions on the different interventions that we're doing for the patients and how they can promote their health. Additionally, we identify risk factors for certain ethnicities. For example, African Americans are at a higher risk for developing hypertension. So that would be a risk factor to talk about with your patients and see how they're managing prevention of that. Researcher. There's always new information on technological and medicinal advancements. Our job is to stay up to date, know what medications are compatible with others, and educate ourselves on different disease processes. Also, we need to look up different medications that we're not familiar with, look at the side effects. This also goes on with education. So we want to educate our patient on the type of research we did on the side effects of medication. That way they know what to expect when taking these different meds. Advocate. I feel like this is probably the most important role a nurse can have. So let's say you have a patient that comes in and they have a lot of bruising, they bleed easily, and their doctor gives them an anticoagulant, let's say warfarin or Coumadin or heparin or something. I would probably question this order, contact the provider and say, hey, is this something that you really want the patient to be on? I noticed this, this, and this. They're bleeding, they have a lot of bruising, and I feel like this won't be very beneficial to them and could additionally cause more problems. So you want to identify these certain things that can potentially harm the patient and maybe question providers on it. I'm not saying that providers are perfect. I'm not saying that they always make mistakes, but it's very good to be aware of your patient's condition and communicate with the provider on maybe some things that probably won't benefit them, or maybe recommend things that will benefit them. So basically, our whole deal with nursing is taking a patient's situation and their assessment data, thinking, what is going on with them? What can I do to help them? And what information can I give them to better manage their symptoms or their disease? Nursing is known to be the #1 trusted field, so it is very important that we uphold fidelity and trust when we are dealing with our clients, and to consider the whole situation along with individual needs and diversity that comes along with that. Thank you very much. That is all for my video.